Hi, I'm Katherine Hartman, and this is my presentation on Williams syndrome. Williams syndrome is a rare genetic disorder. It is caused by a small genetic deletion of about 26 to 28 genes on chromosome 7. It affects roughly 1 in 10,000 people worldwide. What is interesting about Williams syndrome is that the same genetic deletion exists regardless of where an individual might have been born in the world. Common characteristics include an outgoing social nature, an exuberant enthusiasm, a sense of the dramatic, over-friendliness, a short attention span, extra sensitivity to sounds known as hyperacusis, and anxiety, especially about upcoming events. It is important to keep in mind that these are real characteristics of the child and not just syndromal. As educators, it is important to capitalize on and enjoy the very real, charismatic appeal of many children with Williams syndrome. Individuals with Williams syndrome share similar facial features. These features include a small upturned nose, longer upper lip, wide mouth, full lips, small chin, and puffiness around the eyes. Facial features become more apparent with age. The following video from the Williams Syndrome Association provides a quick overview.
Extraordinary gifts, unique challenges, and more than just a few of each. These are the hallmarks of individuals with Williams syndrome. Williams syndrome is a rare genetic disorder which affects approximately 20,000 people in the United States. It is caused by the deletion of 26 plus genes on one copy of an individual's chromosome number 7. Williams syndrome and families of affected individuals encounter major struggles. Individuals born with Williams syndrome share many common facial features as well as a constellation of medical, neurological, and behavioral characteristics. Most individuals with Williams syndrome have mild to severe cardiovascular disorders, often requiring surgery, and many suffer from kidney, bladder, and gastrointestinal difficulties as well. Children with Williams syndrome can experience hypersensitive hearing, feeding problems as infants, developmental delays, poor motor skills, and mild to severe learning disabilities. As they grow, they struggle with things like spatial relations, numbers, and abstract reasoning, which can make daily tasks a challenge. Many adults with Williams syndrome benefit from supportive housing to live to their fullest potential and work primarily in part-time and volunteer positions. Added to that are the extraordinary gifts of Williams syndrome. Unlike many disorders that can make connecting with your child difficult, individuals with Williams syndrome tend to be social, friendly, and endearing. Parents often say the joy and perspective a child with Williams syndrome brings into their lives had been unimaginable, and their special personalities and perseverance help make dreams come true. Individuals with Williams syndrome also have a very special relationship with music. For most, there is a passion for music that in itself can help enrich their lives. For some, the passion blooms into a musicality that far exceeds their abilities in other areas. Adults with Williams syndrome contribute to their communities as both paid employees and volunteers, working in restaurants, at senior centers, and assisted living facilities, in libraries, or as store greeters or veterinary aides. No matter what they are doing, they seem to make a special impact and have a unique ability to quite naturally brighten the days of those around them. Please share this video to help us spread the word about Williams syndrome. Visit us at www.williams-syndrome.org to learn more.
Individuals with Williams syndrome will experience health and medical issues. The majority of individuals with Williams syndrome have some type of heart or blood vessel problem. Typically, there is a narrowing in the aorta, producing a narrowing in the pulmonary arteries. There is a broad range in the degree of narrowing, ranging from trivial to severe, and can require surgical correction of the defect. Since there is an increased risk for development of blood vessel narrowing or high blood pressure over time, periodic monitoring of cardiac status is necessary. Some young children with Williams syndrome have higher levels of blood calcium. This causes extreme irritability or colic-like symptoms, particularly in infants. Occasionally, dietary or medical treatment is needed. In most cases, the problem resolves itself on its own during childhood. Most children with Williams syndrome have a slightly lower birth weight than their siblings. They are slow to gain weight, especially during the first several years of life. Children with Williams syndrome may also experience dental abnormalities. They may have slightly small, widely spaced teeth. They also may have a variety of abnormalities regarding their bite, the tooth shape, or appearance. Most of these dental changes can be fixed through orthodontic correction. Most children with Williams syndrome often have more sensitive hearing than other children. Certain frequencies or noise levels can be painful and or startling to the individual. Things like fire alarms can be very disturbing, or it can be little noises like pencils tapping in the classroom, which could distract them. This condition often improves with age. Young children with Williams syndrome often have low muscle tone and joint laxity. As the children get older, joint stiffness may develop. Physical therapy is very helpful in improving muscle tone, strength, and joint range of motion. It is possible that a student with Williams syndrome may be absent more frequently due to medical appointments and procedures. So what does Williams syndrome look like in the classroom? Children with Williams syndrome have many strengths, including a sociable nature, expressive vocabulary, long-term memory for information, short-term and long-term auditory memory, hyperacusis, which has both positives and negatives. It can help the child with phonics. However, it can hurt the child when they become excessively worried about noises. Children with Williams syndrome can also develop an affinity for music. As with all children, it is important to recognize and build on a student's strengths. It is particularly important to meet with a student with Williams syndrome and their family early in the new school year, as they will be able to provide valuable information about their child and the unique challenges they encounter. Areas of concern include attention difficulties, visual spatial and visual motor integration difficulties, also known as hand-eye coordination, fine motor skills, visual memory deficits, and a difficulty with abstract concepts and abstract reasoning. Educational strategies can include speech therapy, minimizing sounds in the classroom, encouraging positive thinking. It's important to teach students with Williams syndrome how to reframe the way they think, monitor sadness, social skills training, which is important because they need to know how to maintain long-term friendships, and technological supports and tools, particularly when a student has difficulties with fine motor skills. In my research, I came across 3 resources that were particularly useful in terms of educational strategies for students with Williams syndrome. The first is the Teacher's Gateway to Special Education. This website includes a plethora of possible adaptations specific to Williams syndrome. It's also a great resource for other adaptations suited towards other identifications. The second is from the Government of Alberta website. LearnAlberta.ca has a checklist of steps and strategies that you can follow to help with the inclusion of students with Williams syndrome. And the last website is from the williams-syndrome.org website. This website has a wealth of information regarding Williams syndrome, but it also provides an educational profile in the form of a fact sheet, which is particularly useful for anyone who has a student with Williams syndrome. The following is a video taken from the Williams Syndrome Association. It will allow you to get to know a few individuals with Williams syndrome and some of the challenges that they face.
Small set of genes surrounding the elastin gene on chromosome 7. We have 30,000 genes in the brain. We're talking about 20 or 25 genes in one little place on one particular chromosome. And it turns out that when that is missing, when that lops off in the very, very earliest stages, it gives rise, wherever that occurs in the world, to an individual with a very unusual profile.
I want to know your definition of what Williams syndrome is.
Okay. Williams syndrome is a birth defect I was born with.
Most people with Williams syndrome love interaction, they love engagement, they love to catch your eye and get a smile, and I almost feel like that's candy for them. It's like, oh good, I caught another smile, or like someone fishing, I caught one and it felt so good.
If I ever get the chance to actually go in a real recording studio with a big bass fiddle, believe me, I'll call you so I can record with you, man.
I work at Cracker Barrel. I'm a greeter.
Ooh, I bet you're good at that.
I am. I always take people to their tables and I make everybody happy. I heard nice compliments. The bosses are very happy and I make everybody happy. I'm a happy man for the rest of my life.
Williams people are very musical. They love music, they love arts, they love dancing, so that's a very cool thing about Williams syndrome.
I think there is something special about Williams syndrome and music in a couple of ways. I mean, so many people with Williams syndrome have intense emotional responses to music, intensely happy. So I just think a lot of people with Williams syndrome feel music more emotionally.
Tell me about your love for music.
Oh, music to me is like the soundtrack of the world.
What do you say about the challenges of Williams syndrome? How would you characterize those?
Well, there are many, different challenges. When you get to see someone who has Williams syndrome, it's like a whole different world.
Now you do it, Ben, and stay on the road. Oh, you went off the road a little bit. Let's try it one more time. We're going to take it.
Students with Williams syndrome have a difficulty focusing. They are known in general to have poor focusing ability. It's compounded by an inability to filter out other students in the room who may be working on a different project, and because of their hypersensitive hearing, they can often even hear things going on in the hallway or in the classroom next door, and those all become distractions.
When you test a child with Williams syndrome, you might get an overall IQ that's in the high 50s or low 60s, but verbal abilities and nonverbal reasoning abilities potentially in the 80s. So a huge discrepancy, and it means the overall IQ is not a valid indicator of the child's abilities.
It's hard because you are so beautiful, but you have so many health problems that you can't take care of, or it's hard to handle.
There's a considerable range of medical problems in individuals with Williams syndrome. Some folks have relatively few medical problems, whereas others have the potential for significant involvement in many organ systems. The most prominent area of medical problems that affect people's lives are the cardiovascular area.
Ben has severe stenosis problems. So it's supravalvular aortic stenosis, which is the classic Williams syndrome marker, which is a very distinct narrowing just above the valve. For Benjamin, he has, basically multiple narrowings throughout his vascular system. The first surgery was at 6 weeks. The total blockages have happened slowly, over a long period of time, and his body has just made adjustments along the way. We had flow studies done, and they basically just shook their head and said, okay, well, it works. If he has a problem, call us. If not, don't. But he's kind of a mystery man, in that regard.
Do you like pretty girls?
Let's see about that question. Sure, who doesn't? That's all I say about that.
Johnny Depp, he's cute. Oh, I have a crush on him. I can't help it.
I like Pamela Anderson.
We were just talking to each other and kind of started knowing more about each other, and we just kind of bonded very easily.
I think we might like to adopt children.
I think it's a blessing for us to be able to eventually provide for a child who would otherwise not have a loving, caring family.
When you found out she had Williams syndrome, what was that day? When was that?
We found out in September of '09 when she was about 9 months old, and it's very heartbreaking at first, but it's kind of like you just have to take it one day at a time, and of course you can see she's a beautiful baby and we love her with everything, so.
No one ever planned to be the parent of a child with a disability. And so then the question is, you have this kid and you love this kid, what do you do? And I think, in the work that I do, the question isn't how do you fix it as much as how do you live with a child with a disability in a way that's good for you and good for the child and good for your family. And so much of that isn't, it isn't like some big idealistic thing. It's about the moment-to-moment interactions that you have with your child. Count the blessings first, and then we'll figure out how to do something with the challenges. But there are endless blessings to count. And when you see a child that has Williams syndrome that's so full of life and so happy that you don't think about that's a child with a disability, you think, wow, what a cool kid. What a really cool kid.
In her novel, The Boy Who Loved Too Much, a true story of pathological friendliness, Jennifer Lotson observed that, despite their disadvantages, people with Williams highlight some of humanity's best features. Thank you for listening to my presentation, and I look forward to discussing the topic with you and how you might accommodate a student with Williams syndrome in your classroom.